In a society, we are judged more often than not by how we take care of the vulnerable population. And if we were to give ourselves a grade, I would probably say we're not doing a great job because we haven't provided enough funding, right? We haven't provided enough support. Talk a little bit about the funding piece, because I know that a lot of the funding that was put into play with the pandemic has ended. And so what are some of the trends that you're seeing, or what are some of the challenges that you're seeing relative to funding for these nursing homes and skilled nursing facilities?
Sure. So I think one of the biggest things is occupancy first, because if we've got a low occupancy rate, that's less income ability for these facilities.
Right.
Some of that right now is being held back by workforce because they simply need to be able to just care for the residents that they have in their facility. They can't admit new patients into their facility if they don't have the additional staff. That then backlog the hospitals, and then hospitals are upset and they've got their own funding issues and their requirements, and so it can be this one big chain of events just all tied to being able to take new patients into their facility. Secondly, we have a reimbursement rate in Utah and around the country that through Medicaid is just, like I said earlier, chronically underfunded. And in Utah, Medicaid funds the majority of long-term care patients in these nursing homes. And while Medicare is great and it helps provide for some rehab care and some of that at the beginning of their stay, once that's gone, these residents are relying on the state, Medicaid to provide for that. And if they're giving a rate that's underfunded, that's too low and doesn't cover the increased workforce costs, the increased costs in supplies. I mean, grocery bill. Who doesn't go to the store, right now? And it's ridiculous to try to even just afford groceries. Imagine trying to buy it for 100 or 200 residents in a facility when all your other costs are going up as well, and you're trying to stay within your budget while being able to provide the same care. So I think the reality is we just need to be able to get more funding in these facilities so that they can continue to provide this great care that they have at a decent rate, and just to be able to continue to be competitive and hire workers at increased wages that they need to and that they're already doing. They can't continue to operate in a situation of being underfunded.
Yeah, it's interesting. Skilled Nursing News has reported on this in a regular cadence, talking about this staffing issue. And you mentioned before, this is really not about how can we make as much money as possible, right? This is about how do we provide a living wage for these workers in the skilled nursing facilities so that they can maintain a lifestyle that is functional, right? I mean, no one in these facilities is becoming extremely wealthy by working there, and we need the funding in order to get people to stay on board.